Okay, thank you very much. I'm Caleb Tiller from the UN Foundation here at the Digital Media Pavilion at the 2011 mHealth Summit. And I'm here with Kerry McDermott, who's Senior Policy Director of the West Wireless Health Institute. Kerry, thanks for being here. Really appreciate it.
It's my pleasure to join.
And Kerry moderated a session here at the summit and is here to talk to us not only about that session, but also about the policy track here at the summit in general. So hopefully an opportunity to really bring policy down to a more human level and help people understand what those policies really mean. So if you could tell us a little bit about the whole track and what that accomplishes and kind of bring that home for viewers who are watching on live stream who couldn't be here.
Sure, well, happy to do my best with that. So, when we think about policy is all about the rules that are set up to govern a space. And in this case, it's largely the governments that are setting up the rules for mHealth. And so the overall purpose of the policy track was to help folks understand who the key agencies are, what it is that they do, and then give them an opportunity to explore some of the key issues that are affecting mHealth. The Food and Drug Administration is responsible for making sure that these devices that enable mHealth are actually safe and effective.
Okay.
The Federal Communications Commission is really about the enabling infrastructure. So the FCC is responsible for the airwaves, so everything that makes wireless happen.
Okay.
They're responsible for commercial wireless, and they have another responsibility with regard to the devices, and that's in making sure that the devices don't interfere with each other. So
Okay.
your mobile health solution works, and mine works at the same time. And then, of course, CMS is thinking all about what do we pay for and how do we pay for it. So their representative was able to talk about some of the new payment mechanisms they're putting out there and trying to make the ties to mHealth Solutions. And then Dr. Harris from HRSA was also able to give a more global perspective as far as what's happening across the federal space, leading initiatives there. And HRSA has an interesting role in this as well because they serve underserved populations. So as we think about the challenges in the developing and developed world and where they sort of overlap, HRSA is the challenges and the populations they're trying to support are very similar in some ways to those in the developing world.